Today we will be talking about the services which we provide here in the Department of Neurosurgery at SPARSH Hospital. With me joining is our Chief Neurosurgeon, Dr. Arvind Bhateja, who's been the lead neurosurgeon for many years, brain surgeries, including the simple and complex procedures which we do it routinely here. Next, coming to you, sir.
Hi, Usman.
Could you please tell us that the services which we provide here and what is that which we do uniquely, which makes us different from others?
Well, as you're well aware, we have a busy practice where we are seeing patients every day in the outpatient department regularly, and then we're also regularly performing various kinds of brain and spinal surgeries here at SPARSH Infantry Road. We basically operate almost all kinds of surgical diseases which involve the brain and the spine, barring a few, and those are some kinds of specialized procedures which we don't do. Predominantly things like deep brain stimulation, which is particularly meant for diseases like movement disorders. But apart from that, the entire spectrum of diseases such as brain tumors, aneurysms, vascular malformations, various types of brain tumors involving the brain and the tumors involving the spinal cord as well, we handle regularly on a day-to-day basis. In addition to that, we have a vast array of spinal disorders that we manage, right from things that are involving the so-called craniovertebral junction, the cervical spine, which is a place where we routinely commonly find a lot of issues, particularly degenerative disc diseases, myelopathy and so on, and infections in the spine, particularly what is very common in our country, which is tuberculosis. And then in the lumbar spine, what we routinely encounter things like degenerative diseases such as disc diseases, spondylolisthesis, both degenerative as well as ischemic or lytic spondylolisthesis. In addition to all this, we also manage deformities of the spine. So many patients who present to us with various deformities.
I would like to ask him about the new techniques, including the high-tech machineries which we have acquired and we do use it in our regular practice. We would like to know more about it, sir.
So in association with Sita Bhatija Trust, since we have a partnership between Sita Bhatija Trust and SPARSH for running the neurosurgery services here, we have probably one of the best equipped operation theatres in the city, if not the state. And that includes things like the state-of-the-art Zeiss Kinevo 900 operating microscope, which also doubles up as what is called an exoscope, which has 3D visualization capabilities. It has some special features such as intraangiography, intraoperative tumor fluorescence, and so on. In addition to that, we also have a number of other equipments which we routinely use for almost all our surgeries. These are things like neuronavigation, which is similar to GPS for the brain and the spine. This helps us to navigate our way, especially when we're accessing difficult to reach places in the brain, and gives us a sense of where we are in space during the surgery, which is very important so that we can address the disease as well as avoid critical structures. Then we have something known as the O-arm, which is a type of intraoperative imaging capability which we use in the operation theatre, which is very similar to a C-arm, and its predominant role lies in imaging of the spine, both the upper part, the cervical spine, the thoracic spine and the lumbar spine. The interesting thing about the O-arm is that it gives us a very quick scan of the spine in the operation theatre. So it's very critical in certain cases that we image the patient in the position in which we are doing the surgery, because as you know, the spine is a very mobile organ and it can change position. So during the time in the operation theatre when the patient is under anesthesia is the time that we need that information, and the O-arm enables us to gather that information in real time. In addition to that, it scans very quickly, so it's the whole process of scanning the spine and getting those images onto the navigation. So the O-arm works very closely with the navigation. So getting those images and getting it onto navigation takes all of about maybe 60 or 70 seconds, and during that time we protect ourselves from the radiation of the O-arm. So it's a path-breaking technology when it comes to navigation guided surgery in the spine. And the other advantage of the O-arm is that we can re-image the patient more than once. So if we need to check that what we've done is adequate, our implants are in position, we've addressed whatever needs to be tackled during surgery, we can always confirm with the O-arm in the operation theatre before we take the patient out of the operation theatre. So that's a huge advantage. In addition to that, we have what is called neuromonitoring. So neuromonitoring is a very critical tool when we're operating on critical areas of the brain and the spinal cord. The reason is that when a patient is under anesthesia, there are many aspects of the nervous system that we cannot assess because the patient is under anesthesia. So to enable us to assess these functions, we use a system called neurophysiological monitoring. And this gives us an idea about what is happening to the nerves, the spinal cord, the brain when we are operating near it or around it. And it gives us, it's like an early warning system that warns us if any damage is likely to occur or is imminent, so that we can take steps to prevent any damage during the surgery. This is very critical because we certainly do not want any of our patients to wake up from surgery finding that they are paralyzed or they're not able to speak or they have various kinds of problems related to the surgical procedure. And neurophysiological monitoring gives us that extra measure of confidence that we can perform the surgery without causing any harm to the patient. And I think you've also been part of many surgeries where you've seen what a huge difference it can make to our surgeries, and it sort of ensures that patients can go home intact, walking and happy that the surgery went well. Apart from all this, we have various other systems in the operation theatre. We have something known as the CUSA, which is the ultrasonic aspirator, which is specifically meant for tumors located within the central nervous system. This enables us to pulverize the tumor and to get it out without causing any pull or traction on surrounding important nerves or blood vessels. Then, of course, the whole gamut of other instruments, the C-arm, the drills, endoscopes. So we do a lot of procedures, some of them through the nose, where we approach certain tumors or lesions in the skull base, so which are easily accessible through an endoscope through the nose. And now we have recently also acquired the 4K endoscope camera, which gives us much superior visualization. We can see very fine anatomical details, tiny vessels, tiny blood vessels, tiny nerves, which cannot be seen otherwise with a normal endoscopic camera. So this 4K visualization enables us to operate with a lot more confidence on these patients.
This was the gist of insight which we usually do day-to-day process. I would like to ask sir to give the final message to everybody.
So the basic policy in our department, the principle and the philosophy behind our department is that we would like to help our patients achieve a good outcome from whatever issue they're suffering from with the least possible pain, discomfort and disability. And all these equipments and all our time, effort and expertise goes towards ensuring that we ensure the best possible outcomes for our patients. We deal with a number of critical diseases which are difficult to treat sometimes. Sometimes there's a very fine line between success and failure, and we try to make sure that we stay on the right side of that line all the time. Although neurosurgery and spine surgery by itself is a difficult specialty, it's challenging, it's demanding. There can be a lot of things that can go wrong. But I have to say that in the last few years, now that we've acquired all this expertise and technology, our results have improved a great deal. And we see patients going home much quicker, much better, with much less pain, and going back to leading their normal, productive, happy lives. And that is very satisfying.